Here's the most fundamental truth about your 2026 Social Security situation, and I'm going to lay it out plainly because that's how you deserve to hear it. The government just announced a 2.8% cost of living adjustment. That's 75 million Americans getting what appears to be a raise starting January. The average retiree will see roughly $56 more per month. SSI recipients get $27 more for individuals, $41 for couples. SSDI beneficiaries average an additional $44 monthly. Veterans receiving VA disability benefits get the same 2.8% increase. Sounds reasonable enough on the surface. But here's where most people stop thinking, and that's precisely where the real consequences begin. Medicare Part B premiums are simultaneously jumping from $185 to $202.90, an increase of $17.90 per month. That's nearly a 10% hike. Now apply simple arithmetic. Your Social Security increase of $56 gets immediately reduced by $18 for Medicare. Your actual purchasing power increase, $38, not $56. That's an effective COLA of roughly 1.9%, not 2.8%. And current inflation is running at 3%. You're still losing ground. The government gives with one hand while the other hand is already in your pocket. This is the reality that won't be explained in the official notices arriving in December. SSI beneficiaries receive their first adjusted payment December 31st, 2025 because January 1st falls on a Wednesday. Social Security and SSDI recipients see the increase in their January 2026 payments. Everything happens automatically, no forms required. Understanding these numbers isn't optional anymore. It's essential for your financial survival. Now let me walk you through what's actually happening here because the devil isn't just in the details. The devil is in the assumptions most people make without ever questioning them. You see, when I look at this 2.8% COLA for 2026, I'm reminded of something I've observed throughout decades of studying human behavior and financial systems. People hear a percentage increase and their minds immediately jump to relief. They think the government is taking care of them. They assume someone in Washington is doing the math to make sure they can afford groceries and medicine. But that assumption, comfortable as it might be, doesn't hold up under scrutiny. The COLA formula itself is based on the Consumer Price Index for urban wage earners and clerical workers. Think about that for a moment. Urban wage earners and clerical workers. You're a retiree, possibly in your 70s or 80s, maybe living in a small town in Missouri or a suburb in Florida, and your cost of living adjustment is calculated based on what young office workers in cities are spending their money on. Does that sound like an accurate representation of your expenses? Of course it doesn't. Seniors spend vastly different percentages of their income on health care, prescription drugs, and housing than working-age urban employees do. But that's the formula we're stuck with, and it's been that way since 1975 when Congress decided this was the fairest approach. Fair for whom exactly? That's a question worth asking. Let's dig into what this means for each group of beneficiaries because the impact isn't uniform and the differences matter enormously. For traditional Social Security retirement benefits, the average monthly payment is jumping from about $2,000 to roughly $2,056. That's the number you'll see in the headlines. But averages obscure reality. If you worked a lower-paying job throughout your career, your benefit might be $1,200, and your increase will be about $34. If you were a higher earner, your benefit might be $3,000, and you're looking at $84 more. The percentage is the same, but the actual purchasing power varies dramatically. And here's something most people don't consider. If you're still working while collecting Social Security and you're under full retirement age, which is 67 for anyone born in 1960 or later, you face an earnings limit. In 2026, that limit is $23,400 annually. Earn more than that, and Social Security withholds $1 for every $2 you earn above the limit. The COLA doesn't change this fundamental constraint on your ability to supplement your income. For SSI recipients, the situation is even more complex and frankly more troubling. Supplemental security income is designed for the most financially vulnerable Americans, those who are elderly, blind, or disabled and have limited income and resources. The maximum federal SSI payment for an individual in 2026 becomes $976 per month. For couples, it's $1,464. That's the absolute ceiling. Now, many states add supplemental payments on top of the federal amount, but those vary wildly. California adds substantial amounts. Arizona adds nothing. If you're an SSI recipient in Texas, you get the federal payment, and that's it. And here's the cruel arithmetic that nobody talks about. If you receive any other income, even small amounts, it reduces your SSI payment dollar for dollar in many cases. Got a part-time job earning $300 a month? Your SSI gets reduced. Received a gift from a family member? That counts as income. The system is designed with poverty traps built right into it. And the 2.8% COLA doesn't change those structural problems one bit. SSDI, or Social Security Disability Insurance, operates under different rules than SSI, and understanding the distinction is crucial. SSDI is for people who worked and paid into Social Security, but became disabled before reaching retirement age. The average SSDI payment in 2026 will be approximately $1,581 per month after the COLA adjustment. That's about $44 more than 2025. But SSDI recipients face unique challenges that the COLA doesn't address. There's a 5-month waiting period before benefits begin after you're approved, which hasn't changed in decades despite inflation making those 5 months increasingly devastating for families. There's also a trial work period where you can test your ability to work, but the rules are Byzantine. In 2026, any month where you earn more than $150 counts as a trial work month. You get 9 trial work months in a rolling 5-year period. After that, if you earn over what's called substantial gainful activity, $1,220 per month for non-blind individuals in 2026, you can lose your benefits entirely. The COLA increases both these thresholds slightly, but it doesn't change the fundamental precariousness of the situation. Veterans receiving VA disability compensation get the same 2.8% increase, and this is important to understand because it operates separately from Social Security. A veteran with a 100% disability rating will receive approximately $4,292 per month in 2026 for themselves, with additional amounts for dependents. A veteran with a 30% rating gets about $518 monthly. The VA system uses disability ratings in 10% increments, and the compensation varies accordingly. What many veterans don't realize is that VA disability compensation is tax-free and doesn't count against Social Security earnings limits. You can receive full VA disability, work a full-time job, and collect Social Security retirement benefits simultaneously without penalty from the VA side. The Social Security Administration has its own rules about earnings, but the VA doesn't reduce your disability compensation based on your income. This is a significant advantage that too few veterans understand or utilize properly. Now let's return to the Medicare premium situation, because this is where the numbers get particularly instructive about how the system actually works. The standard Part B premium jumping from $185 to nearly $203 represents the largest dollar increase in recent years. But here's what makes this especially significant. Medicare premiums are deducted automatically from your Social Security check before you ever see the money. Most people never write a check to Medicare. They just see a smaller Social Security deposit in their bank account. The psychological impact of this matters. When you don't actively pay for something, you tend to underestimate its cost. You might know intellectually that you're paying for Medicare, but emotionally, it doesn't register the same way as writing a check or swiping a card. This allows premium increases to happen with far less public outcry than would occur if seniors had to actively write larger checks each month. The Part B deductible is also increasing to $250 in 2026, up from $240. That's the amount you pay out of pocket before Medicare starts covering your doctor visits and outpatient care. And the Part A deductible for hospital stays is jumping to $1,176 per benefit period, A benefit period starts when you enter a hospital and ends when you've been out for 60 consecutive days. If you have multiple hospital stays in a year, you could face this deductible multiple times. The COLA doesn't account for these increases adequately. It can't because it's based on general inflation, not the specific healthcare inflation that seniors actually experience. Healthcare costs for seniors have been rising faster than general inflation for decades, and nothing in the 2026 COLA changes that trajectory. There's another dimension to this that deserves serious consideration: the taxation of Social Security benefits. Many people don't realize their Social Security is taxable income. If your combined income, which is your adjusted gross income plus non-taxable interest plus half your Social Security benefits, exceeds certain thresholds, up to 85% of your Social Security becomes taxable. For individuals, if your combined income is between $25,000 and $34,000, up to 50% of benefits are taxable. Above $34,000, up to 85% is taxable. For married couples filing jointly, the thresholds are $32,000 and $44,000. Here's the kicker: these thresholds haven't been adjusted for inflation since 1984. Think about that. The income levels that determine taxation of your benefits have been frozen for 40 years while everything else has inflated. The 2026 COLA pushes more people over these thresholds, meaning more of their benefits become taxable, which effectively reduces the value of the COLA itself. It's a stealth tax increase that compounds year after year, and it affects middle-income retirees most severely. The timing of these payments also creates complications that people need to understand. SSI recipients get their January payment on December 31st, 2025 because January 1st is a holiday. This sounds like a nice early gift, but it can create problems for people on tight budgets who aren't expecting the money early and might spend it before January expenses hit. Social Security, retirement, and SSDI payments follow the regular schedule based on your birth date. If you were born between the 1st and 10th of the month, you get paid on the 2nd Wednesday. Born between the 11th and 20th, you get paid on the 3rd Wednesday. Born after the 20th, payment comes on the 4th Wednesday. People who started receiving benefits before May 1997 get paid on the 3rd of each month, regardless of birth date. Understanding your payment schedule matters because utility companies, landlords, and credit card companies don't care about Social Security's payment calendar. They want their money on their schedule. And if your Social Security payment doesn't align with your bills, you can end up with late fees that eat into that COLA increase. Let me address something that gets overlooked in almost every discussion of Social Security: the opportunity cost of claiming strategies. The age at which you start taking Social Security dramatically affects your monthly payment for the rest of your life. You can claim as early as 62, but your benefit gets reduced by about 30% compared to waiting until full retirement age. Wait until 70, and your benefit increases by 24% beyond your full retirement age amount through delayed retirement credits. The 2026 COLA applies to whatever benefit you're receiving, but it doesn't change the fundamental math of claiming age. If you took benefits early and locked in a reduced amount, you're getting 2.8% of a smaller base. If you delayed and maximized your benefit, you're getting 2.8% of a larger base. The absolute dollar difference compounds over time. This is why claiming strategy deserves far more attention than it typically receives. People focus on the COLA each year, but the claiming decision they made years earlier has a much larger impact on their financial security. The interaction between different benefit programs creates additional complexity. You can receive Social Security, retirement, and SSDI, but not simultaneously. SSDI converts to retirement benefits at full retirement age. You can receive SSI and Social Security retirement or SSDI, but your Social Security amount reduces your SSI payment. You can receive VA disability and Social Security without offset. You can receive a pension from work where you didn't pay into Social Security, but the windfall elimination provision in government pension offset rules can reduce your Social Security benefits substantially. These rules haven't unchanged for 2026, and the COLA doesn't make navigating them any easier. Many people receive smaller Social Security checks than they expected because of provisions they didn't know existed and didn't plan for. Looking at the bigger picture, this 2.8% COLA needs to be understood in context. Over the past 5 years, COLAs have varied significantly. We saw 5.9% in 2022, 8.7% in 2023, 3.2% in 2024, and 2.5% in 2025. These fluctuations reflect inflation patterns, but they create planning difficulties for retirees living on fixed incomes. You can't budget effectively when your income changes unpredictably year to year, especially when those changes don't align with your actual expense increases. The uncertainty itself has a cost that doesn't show up in any official statistics. It affects decisions about whether to replace a failing refrigerator, whether to visit grandchildren across the country, whether to fill a prescription or skip doses to make it last longer. These aren't theoretical concerns. They're daily realities for millions of Americans whose financial security depends on these programs. The long-term solvency of Social Security adds another layer of concern that can't be ignored. The Social Security Trust Fund is projected to be depleted by 2034 according to current estimates. After that point, incoming payroll taxes would only cover about 79% of scheduled benefits. Congress will undoubtedly act before that happens, but the nature of that action remains uncertain. Possible solutions include raising the payroll tax cap, increasing the retirement age, means testing benefits, adjusting the COLA formula, or some combination of these approaches. Each option creates winners and losers. The 2026 COLA is happening within this broader context of long-term uncertainty, and that uncertainty itself affects how people plan and spend. If you're worried your benefits might be cut in 8 years, you're more likely to save rather than spend your COLA increase, which ironically reduces economic stimulus that could help fund the program. What I want you to understand is that these numbers, 2.8%, $56, $203, aren't abstractions. They represent the difference between filling your prescription and going without, between keeping your heat at a comfortable temperature and wearing sweaters indoors all winter, between maintaining independence and becoming financially dependent on family members. The architects of these systems, well-intentioned as they might be, don't experience these trade-offs personally. They receive different health care coverage, different retirement benefits, different cost of living adjustments. The disconnect between policymakers' lived experience and beneficiaries' reality creates a system that looks functional on paper but generates hardship in practice. The 2026 COLA is the latest iteration of a system that needs fundamental rethinking, not just annual percentage adjustments that barely keep pace with expenses that matter most to the people who depend on these programs for survival.